Good afternoon, ladies. My name is Carmen, and I am the instructor, or the counselor rather, this evening to run the HIV support group for newly diagnosed women. I usually run this group 2 or 3 times a week, depending on the needs of the patients. And I basically just want to talk a little bit about, your diagnosis, how you're feeling, if you're connected with medical care, and any other issues you may have in regards to your diagnosis. So, what is your name?
Sally.
Sally. And when were you diagnosed, Sally?
In the beginning of this year, 2015.
Okay. Tell me a little bit about how you were diagnosed and...
Well, I had to go to the emergency room for some other issues totally different from what we're talking about today. And they asked if I wanted an HIV test, and I said yes. And then I received the test.
Did you have any idea about being positive?
No.
Okay. And what is your name?
Tasha. And I was diagnosed at the end of 2012 in prenatal. I was pregnant with my 4th child, and they offered testing, and I took it, and I didn't think anything, and it came up positive.
And what was the diagnosis of the child?
He was negative, thank God. He was negative. They were able to give me medication early enough, and he's negative.
Great. And you, what is your name?
Melissa.
Tell me a little bit about yourself, please.
Well, I am 23. I was diagnosed 3 years ago at the local health center. So I was getting tested every year, and then I was diagnosed 3 years ago.
So tell me a little bit about the services that you guys each have in place now, and what are other things that you think you may need to help you along with your diagnosis. Who wants to go first?
I have been receiving care in a local clinic, and I've had all types of, initially I was going to a infectious disease doctor in his private office, but I lost my insurance, so I was referred to our local clinic, where I've been getting care for a couple of months now. And it actually benefited me greatly because my kids and I were at risk of losing our apartment. I lost my job, I lost my insurance, I lost everything, and I actually had a case manager in my clinic that made a lot of referrals for me, and I was able to get assistance, so we didn't lose our home. We're not homeless.
Excellent. And is there a history of substance abuse in your...
No, not with me, but with my children's father.
Okay.
Yeah.
Okay. Do you think that that's where the infection came from?
Yeah.
Okay.
Yeah. Heroin use.
Okay. Melissa?
Good question.
Are you receiving care?
Yes, I am receiving care. I'm receiving care at the same place Tasha's receiving care.
Oh, great.
Yes. And they do make a lot of referrals for me there. They've connected me to mental health services, to substance abuse services, which has been a problem for me for many years.
Okay.
And I've been clean for quite some time. They've helped me with my housing. So the case managers there, they definitely helped me with a lot and give me a lot of support that I didn't get before.
Excellent.
I actually get care, but I get care in a private office. I recently
decided to tell my family about my status, and even my husband, because my diagnosis was through an affair that I had, and so my husband is not positive. So I decided that when I wanted to get care that I would do it at a private office, because I didn't want to have to see anybody that would be able to disclose my status to any of my family members as well as my husband.
Excellent. And do you find that that has helped you in coping now with your diagnosis?
I would say no. I mean, I think that everybody's just to themselves. You know, it's privately owned. It's just kind of you go in, you get what you need, and you kind of walk out. There's no... I mean, I've spoken to these ladies before, and they've told me the services that they get, and like, you know, being able to have someone like you and talk to them and stuff like that. Like, there's nobody there that does that, so.
It sounds like you guys are really connected to services. And the purpose of this group was to go over, like, services that you already have and something that you may need to have down the line. Now, with Melissa, you said that you have a history of substance use, right? So, where do you find your medium in dealing with your diagnosis and staying clean?
I go to groups, I go to meetings, and it keeps me out of a lot of trouble. I meet with them 4 times a week, so I try to keep busy doing that. And, you know, just talking about it really helps, staying away from people, you know,
Right.
and those
Right.
triggers, that helps a lot too.
Right. What about for coping mechanisms? What do you guys individually use to cope with just life itself, stressful situations?
Well, the clinic where we receive care, they also offer mental health services. So I've been utilizing those. I don't see the psychiatrist there, but I do see the therapist once a week while my kids are at school. I take the baby, he doesn't make any noise or anything, and I see the therapist there, and she is very supportive. I've also been going through a divorce, so, it's been a rough time for me, a newborn, a divorce, but I think it's because of her and or I attribute my success, a great amount of my success, to the support that I receive there.
It sounds like you have a lot of things going for you.
I do.
And that you are connected to the services that you need to
I
be
am
able to cope.
Yeah, like Sally was saying, when I used to go, briefly to the private office, none of those services were available. So I guess, it was a blessing, that I fell in hard times, because I found, that clinic, and it's been a godsend.
Excellent. Do you have any questions for me?
Well, me, I would like to know if there's any possibility you can help me, like, possibly getting links somehow with where they're going. Because I don't cope, I avoid, so I would like to kind of like,
Absolutely.
change my...
Absolutely. When we end the group now, if you don't have any further questions for me, you can come to my office and I'll give you my card. Each and every one of you is my card. So if you have any questions further down the line and you want to come and meet with me, you can do that. Okay?
Thank you.
You're
Thank
welcome. Even though it's all, so we record it. How long was it? Yay, very good.